So the coming year is going to be the most exciting in MyHealth history. We are in the process of loading the clinical data that's necessary to improve physicians' access to records at the point of care, so that whenever patients are seen, their full records are available, and the physician is not at risk of making mistakes by prescribing something the patient is already on, or creating a conflict with therapies that other providers have given. But more than just having that data available, we're rolling out some innovations that are unique to our community. For example, the Archimedes Indigo tool that we're rolling out really is providing a level of decision support, a level of guidance to the clinician that we've never had before. But because we are providing a whole new level of and volume of data to the provider as they're seeing patients, we felt it was very important to give them some guidance as to what might be within that data. So the Archimedes Indigo tool essentially monitors electronically what's going on with each individual patient's health, and provides a customized risk score for that patient that lets the provider know immediately, and the patient, if they choose, know what is the 5-year risk of a stroke or a heart attack or breast, lung, or colon cancer, and really alert those providers and patients when there's a potential issue that needs to be dealt with. This is something that because of it's being run at a community level within our Health Information Exchange, it's happening in the background all the time, and can really be a benefit to helping find those patients who are most at risk and getting them into care. I think that the other exciting intervention that we're going to continue to grow is the use of the consultation referral tool in the community, that is the doc-to-doc system. And we're expanding its use beyond just consultations and referrals between primary care providers and specialists, but also in guiding and coordinating care as patients go from any physician to any community-based service, but also as patients are discharged from the hospital back to their primary care provider or to a community-based service that might help to prevent them from having to be readmitted. These are all pretty exciting interventions. And then finally, one that has a lot of people talking in this community is our business intelligence environment, which is essentially a system that allows a given physician to work with not only one of their patients at a time, but to work with the information on their population of patients, so they can make the best use of their clinic time and make sure that those patients who need services are contacted and brought in sooner. This is one of those moments in time, I think, in healthcare, where the provider who has forever been in the position of being reactionary, that is, those patients who come to see me, I will try to do the best I can for them at the moment that they're there, instead can take a proactive stance and say, hey, these are my patients. I have a relationship with them, I care for them. I want to be proactive about getting those who need care the most seen, and get them seen in the right order. And so patients in our community should start to hear from their doctors on a more proactive basis once this platform is released.